procedure after hand washing necessary for basic infection control is the isolation precaution. So when you say isolation precaution, you're going to isolate your body or yourself from contact with microorganism, or from the microorganism between you and your patients. So first equipment is your mask, and then second is your gown, another is, and the last one is your gloves. You may also have another isolation precaution equipment such as your bonnet, your goggles, and your booties to the extent. But for this procedure, I'm going to demonstrate only the three important ones. So first is your mask. This is your mask. When you're going to, as you can see, the mask is made of a cloth, but you may purchase also a disposable mask with a garter as a replacement with the tie here present. So you're going to pick up the mask, and then after that, you're going to put it across or over the bridge of the nose like this, and then it should be across your earlobe. And then after that, you're going to tie now the upper string at the bottom part of your hair tie, and then anchor it by making a lace, or it is similar to making a shoelace. Then after that, you're going to put up now the next tie, and then make sure that you're going to include your chin and you're going to cover your chin, and then do it like this. And then after that, going now to tie the upper string, at the lower string, at the uppermost part of your ponytail or your hair tie. Like that. Okay, that's it. So you are already wearing a mask, and then position it properly. And then after that, you proceed with another procedure. In removing the mask, of course, you're going to untie now the lower string. Lower first. Like that. And then next is the upper string, located at the lower part. And then remove now your mask, and make sure to fold it away from you, or secure the portion exposed to your patient. So if this part is exposed to your mouth, so you have to fold it like this, and then discard. Next is your gown. So your gown is worn before contact with patients. In wearing the gown, you have to pick it up, and then after that, try to locate now the armhole of the gown. So as you can see, the gown is folded wrong side out for your convenience. And then you have to insert now your first hand or dominant hand to the gown, to the armhole of the gown. And then the next is you have to insert now your second hand, and then you have to move backward and then wear the gown as one. After that, you're going to locate now your upper string like this and tie it. And after that, the lower string. Again, tie it. Oh, now you are already wearing a gown. After wearing a gown, you're going to wear now the gloves. So, but before that, I'm going to show you first on how to remove the gown. So in removing the gown, you have to untie the lower string first, and then the upper string, like this. Okay. So as you can see, after the procedure, the front part of the gown is exposed to the client. So you have to protect your dress from contact with the microorganism from your client. So you have to lean forward to remove the gown. Then insert now your dominant hand to the sleeve of the gown. And then after that, you have to slide your non-dominant hand for the sleeve to be removed from your dominant hand. Then you have to roll now the gown containing the microorganism, and then after that, you discard. That's it. You are already we're already done with your application of the mask and then application of your gown. So next, the last one to be applied is your gloves. But once the gloves is sealed, it is considered sterile. So you have to maintain its sterility. So you have to open now the gloves from its packing, and then position it. Remember, the folds of the gloves has a purpose. So its purpose is to maintain the sterility of the gloves. So we have there the folds, plus we also have the cuff. As you can see, there is marking left and marking right in the packing. So use the cuff to open now the packing to expose the gloves. After which, you're going to pick up now your first glove concerning your dominant hand, meaning you're going to glove first your dominant hand. And after which, you have to move your hand together with the gloves away from the package where the second glove is located. Why? Because once you're going to mistakenly drop the glove for your non-dominant hand, it makes now the second glove to become unsterile. So apply now the glove to your dominant hand using your palm. So your palm is very important here. Because your thumb is very important, because without it you cannot be able to manipulate the gloves. Okay, and then you will be able to position properly. And then you have to pull now insert now your glove hand to the next glove by inserting your four fingers onto the cuff. As you can see, your thumb should be away from the gloves to prevent it from being unsterile. And then after which, you're going to put now the second glove to your non-glove hand, and then like that. Okay, snap. Okay, you are already wearing gloves. So now you're ready for doing the procedure necessary for the day. Gloves is very much important to protect you from the secretions from the patients. Example of that, we have your sweat, your blood, even the urine of the patient. So that is why you have to use gloves. Another thing, even feces from the patients. So next is, after doing the procedure, you have to remove now your gloves by pulling it out like this, and then holding now the removed glove with your glove hand still, and then you have to snatch now the second glove, and you have to throw now the gloves as one piece to the trash can, or to the rest is now ready for disposal. But as much as possible, you have to dispose it immediately. So that's the procedure necessary for your isolation precaution. Next to hand washing. So namely, we have done the application of the mask, then the gown, and then the gloves. And then during removing removal of the 3 equipments, you have to remove first the gloves, and then after which the mask, and then the gown. Okay, that's it. That's it. The